Hello, my name is Caitlin Jackson, and I chose to do my community research project on the topic increasing the proportion of pregnant women who receive early and adequate prenatal care. Now, I chose this topic not only because it interested me, but I also saw a need in my community to educate them about prenatal care. Now, what is prenatal care and what does it include? Well, according to the Office of Assistant Secretary of Health, they state that prenatal care is the health care you get while pregnant. In another definition by Planned Parenthood, they state that prenatal care is when you get checkups from a doctor, nurse, or a midwife throughout your pregnancy. It helps keep you and your future baby healthy. Now, the Mayo Clinic gives several examples of prenatal care, such as physical exams, lab tests, screening for fetal abnormalities, lifestyle change, as well as dental care. Now, under physical exams, we will check the patient's weight, the height, and the BMI, also to check their vital signs, especially their blood pressure. And the doctor will discuss with them how much weight should be gained for them to have a healthy pregnancy. Now, other exams that could be done is a pelvic exam, a breast exam, could also do screening of the heart, lungs, and thyroid. They can also check for cervical cancers as well. Now, under lab tests, we're going to check the blood type Rh. If the patient is Rh negative, but the baby is Rh positive, the mother's body is going to create antibodies that will negatively affect future pregnancies. Now, hemoglobin. We're going to assess their hemoglobin levels. If they are low, that could indicate anemia. Blood tests will be done, such as Hep B, syphilis, gonorrhea, chlamydia, and even testing for HIV. Urine samples will be done to check for bladder infections and urinary tract infections. Screening tests for fetal abnormalities will be done. We do this through genetic testing, ultrasounds, and also blood tests for Down syndrome. Now, lifestyle change. We're going to speak to the patient about not smoking during pregnancy, not drinking alcohol during pregnancy. We're going to speak to them about nutrition, what they should and shouldn't eat, about taking prenatal vitamins, and also about medications, because many medications are harmful for the developing fetus. Now, as far as dental care goes, according to a study conducted by Oral Health Foundation, they found that women who went into early labor recorded gum health scores 4 times lower than those who had a timelier birth. They also found that they were 8 times more likely to have plaque. Now, why is prenatal care so important? Well, a healthy pregnancy equals a healthy birth. Well, we can never guarantee that a mother will have a healthy birth, but if they have a healthy pregnancy, they are much more likely to have a healthy birth. Now, according to OASH, a baby is 3 times more likely to have a low birth weight and 5 times more likely to die if the mother doesn't receive any prenatal care at all. Now, another reason why prenatal care is so important is because doctors can spot health problems earlier on. As I spoke about earlier, about the blood test that can be done to detect Down syndrome, if the mother and the mother's support system knows that the baby has Down syndrome, they can better mentally and physically prepare for the baby's disabilities. Now, how does someone's culture and ethnicity affect their prenatal care? Well, according to the CDC, Black, American Indian, and Alaska Native women are 2 to 3 times more likely to die from pregnancy-related causes than white women. This may be due to a lack of education that those women are receiving. Another study from the Kaiser Family Foundation found that cardiovascular problems were much higher in Black women than they were in white women. This could be due to biological factors. On another study, according to the National Center of Health Statistics on late to no prenatal care by race and ethnicity from 2018 to 2020 in the state of Florida, 7.6% of Hispanic women receive late to no prenatal care, 7.2% of white women, 10.4% of Black women, American Indian and Alaska Native women, 9.8%, Alaska and Pacific Islanders, 6.2%, received late to no prenatal care. And the total amount is 8% for the entire state of Florida. This means that in the state of Florida, 8% of pregnant women had little to no prenatal care at all. Now, this could contribute to lifestyle factors such as smoking and where the patient lives, or socioeconomic factors such as education and the family income. Now, why do some women choose not to receive prenatal care? Well, they may not know they are pregnant. If you don't know you're pregnant, you're not going to go and receive prenatal care. High costs of prenatal care. Many patients don't have insurance or don't know that they can get insurance. And another factor is they may be anxious about prenatal care. Now, they may have anxiety about going to the doctor's office. They may have anxiety about invasive procedures. Teen pregnancy, a lot of teens are anxious to tell their parents that they're pregnant, and they are also anxious about what their peers will think of them and view them. Now, also social and cultural, cultural stigmas can also be attached. Many women who have lots of children, some cultures frown upon women having lots of children. Now, as nurses, what can we do to improve early prenatal health? Well, we can encourage a healthy diet full of fruits and vegetables. We can explain to them what foods they should avoid, such as caffeine, because it increases blood pressure and also encourages irregular heartbeat. We can explain to them that they shouldn't be eating seafood because of the levels of mercury within it. We're going to talk to them about prenatal vitamins, what kind of prenatal vitamins they should be taking. They should be taking folic acid to prevent neural tube defects. They should be taking calcium to prevent hypocalcemia. They should be taking vitamin D. It not only helps the calcium absorb in the body, but it also helps with overall fetal development. Now we're going to talk to them about immunizations. We're going to speak to them about what immunizations they should be getting, such as the flu or Tdap. And we're going to also ask them about the 5 A's of smoking. Now, according to the Davis Advantage Basic Nursing, the 5 A's of smoking are ask. We're going to ask them about their tobacco use. We're going to also advise them to quit. And we're going to assess their willingness to quit. And then we're going to assist them with quitting. And we're also going to arrange for a follow-up visit. Now, in these pregnant women, we're also going to talk to them about secondhand smoking, because a lot of secondhand smoking is worse than firsthand smoking. And we just want to address that for them to stay away from smokers. We're also going to encourage physical activity. At least 30 minutes of walking a day will greatly impact not only their health, but also the developing baby's health. And we're also going to speak to them about their mental health. Are they anxious about anything about their pregnancy? Are they depressed about anything about their pregnancy? Their body is changing. A lot of changes are happening, and they could be depressed or anxious about those changes. Now, we're also going to talk about their support system. What support system do they have? Do they have friends, family members around? Is the baby's father around to help through those changes? Now, education and resources. Now, around our community, there are many resources that can help with pregnant women, help pregnant women in their prenatal care journey. Now, a state-funded organization in our area is Healthy Start Coalition of Flagler and Volusia County. They are located in Daytona Beach, Florida. And they provide Spanish and English speaking classes, and also provide educational flyers as well in both Spanish and English. Now, some nonprofit organizations that are in our community are Resources for Women. They are located in Daytona Beach, Florida. They help women with lab tests that can be done. They do ultrasounds there, and they also provide different classes that women can take. Now, another nonprofit organization is Grace House Pregnancy Center. They help women by giving them free pregnancy tests and also free consultations. And they even have information for the father to help throughout the journey of the mother's pregnancy. Now, this concludes my presentation. I hope you enjoyed.